Yeah, I'm Kelechi Enuma. This is my checklist. Okay. So yeah, as I'm coming into my patient's room. As I'm coming into my patient's room, I'm checking my patient's environment to ensure my patient's environment is safe for her. I'm checking the equipment if they are functioning and well plugged. I'm checking if the patient is on oxygen and checking if the oxygen is well placed. I'm checking if the patient is breathing. I'm checking if my patient is alert or awake. I'm checking if my patient is confused or in a good state. Okay, yeah, that's this happens to be my patient. Yeah, hi, Mrs. Susie. I'm Nurse Kelechi. I'm going to be your nurse today. May I confirm your own name? Okay, and your date of birth? Okay, that seems good. Yeah. Okay, I'm gonna put my patient in a semi-Fowler's position, like a kind of sitting up position this way. Yeah. Okay. Yeah. Before I proceed, Mrs. Silver, is there anything you want me to do for you? Are you in pains? Do you have any discomfort? Okay. So if there's nothing I can do for you, I can carry on. Okay. Okay. So, Mrs. Susie, I'm here to do your respiratory assessment. Yeah, to follow up with your respiratory system to be sure you're doing okay. Okay, and I'm going to be asking you some questions, which is going to be a kind of me finding out your past respiratory history. Can I proceed with that? Okay. Yeah, Mrs. Susie, have you had any respiratory issue in the past? Okay. Yeah, have you had any respiratory surgery, respiratory system surgery, or any respiratory procedure? Okay. Do you smoke or vape? Hmm. Okay. Where do you work and what kind of work do you do? Do you work in a place that exposes you to toxins, that exposes the respiratory system to toxins? Okay. Yeah, do you have difficulty in breathing most times? Maybe when you're lying down, do you find it difficult to breathe, or when you're standing up? Okay. Um, do you have any edema? Okay. So, Mrs. Susie, I'm going to proceed with my assessment. Yeah, in my assessment, I'm going to be doing an inspection followed by a palpation. I will do a percussion and finally an auscultation. So, first of all, I'm going to start with assessing your upper extremities, your head and neck region. Yeah, I'm going to be checking your face to ensure everything is okay. Is your facial appearance, does it look good? Do you have any lesions on the face? Are you cyanosed in any way? Okay. I'm checking for scars. Is your skin flushed or anything? Okay. Yeah, I'm also gonna check, are you cyanosed? I'm checking if you're cyanosed. Okay, I'm checking your nose, if they are flaring, like the tip of your nose, if it's expanding, like trying to seek for more air into the lungs. Okay, and I'm also checking for positive breathing. Oh, okay, I can't find any cough. Oh, no cough. Any oxygen in place? Okay, no oxygen in place. Everything seems to be okay. Yeah, I'm gonna be checking your neck region. Checking your neck region. This happens to be your neck region. I'm checking if there's any use of accessory muscles. Like when you're using an accessory, it means you're finding it difficult. You're trying to compensate. Okay. I'm also going to check your trachea. This is your trachea. Is at the midline. Does it look okay? Hmm. Okay. And also, this is your suprasternal notch, just below the not just below the just below the trachea, almost at the clavicle region. Okay. Okay. So I'm gonna be auscultating for bronchial breath sounds and your voice. So I'm gonna be using my stethoscope and be with the diaphragm. I'm gonna be assessing the bronchial breath sounds, and that should be around the side of your trachea. Can you say something? Because I'm assessing your voice also. Okay, checking the bronchial breath sounds. Yeah, the bronchial breath sound seems to be like a loud roaring noise. Okay, a loud roaring sound. Okay, yeah, I'm gonna be inspecting your anterior chest region. Okay, yeah, I'm checking for the skin color, any discoloration. Is this nose? Is it flushed? Or does it look dry? Does it look moist? I'm checking the symmetry, if it seems equal or if everything is okay. Yeah. Okay. I'm also checking the shape of the anterior chest. Does it look flat or does it look round or any? Okay. I'm gonna be palpating your anterior chest, Mrs. Susie. I'm gonna be palpating for tenderness, palpating for lungs, if I could find any lungs. I'm going to be palpating for bones. I'm also palpating for abnormal vibrations, palpating for temperature, moisture. Okay, yeah. I'm also going to be palpating your lymph nodes, Mrs. Susie. Yeah, I'm going to be palpating for any tenderness of the lymph nodes. So I'm going to be doing it from the jawline down, down to the clavicle region, yeah, and down to the axilla. Okay, everything seems okay. Yeah, I'm gonna be checking your chest expansion, okay, if it's symmetrical. Yeah, this is the breast region, so I'm gonna be placing my hand under the breast region with my thumbs towards the rib. So can you breathe in? Inhale, exhale. Inhale, exhale. Breathe in, breathe out. Breathe in, breathe out. Yeah, sorry, can I lift your breast up? I'm checking for any redness. Okay, it seems it looks okay. Yeah, okay. Mrs. Susie, I'm gonna be percussing you right now. I'm gonna be percussing the anterior chest region, and it should be around the lung fields. Yeah, I'm gonna be percussing the lung fields. Yeah, the lung fields always have a resonant sound, except when we get to the heart, which has a dullness sound. And towards the left lower, it has a hyper resonance because of the stomach. Okay, everything seems okay. Yeah, I'm gonna be auscultating right now with my stethoscope. And before I proceed with that, I have my mid-sternal line here. I have my mid-clavicular line. I have my mid-axillary line. I also have my first intercostal space, first first intercostal space, second intercostal space, third, fourth, and the fifth. So I'm gonna be auscultating that. Those are the landmarks. So while auscultating them, I'm going to be using my stethoscope and using the diaphragm. So while auscultating, I'm checking for the normal breath sounds, which is the bronchial sounds, the vesicular sounds, the bronchial vesicular sounds. Breathing out, breathing, breathing out, breathing, 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 breathing out. Okay. Yeah, the fifth intercostal space is just below the breast region, just towards the axilla. Yeah, in the normal breath sounds, the bronchial sound is normally heard around the neck region, just from the trachea to the suprasternal notch. Yeah, that's where the bronchial sound is heard, and it is a loud whirring sound. Okay, and also the bronchial vesicular is heard at the center of the anterior chest towards this region. That's where the brochiovesicular is head. Yeah, is also like the vesicular, but it's quiet. It's more quiet than the vesicular sounds. And also the vesicular sounds, they are heard on the lung tissues. The right lung tissue, the left lung tissues. So they are heard this way, the lung tissues. And while I was assessing for the normal breath sound, I was also assessing for the adventitious sounds, which happens to be the added sounds, like the extra sounds you hear on those regions together with the bronchial sound. They are different from the bronchial sound. They are the added sound. It could be crackles, it could be wheezing sound, it could be tridal sounds. Yeah. So right now, Mrs. Susie, yeah, you're gonna be sitting up for me. Okay, this is your front. So let me take this one to be your back region. This is Mrs. Susie's back. So please permit me to put it this way. Yeah. Um, the back region, the posterior region, I'm still gonna be using the same inspection, palpation, percussion, and auscultation. So I'm gonna be inspecting the skin to check if there's any discoloration, to check if they are cyanosed, flushed, dry, moist. Okay, okay. And I'm also gonna be checking for the symmetry, if it seems equal or flat. Okay, everything seems equal. Yeah, I'm gonna be palpating for abnormalities, and while palpating, I'm gonna be checking like the way the ribs are the ribs out. Are you very bony? Is there any problem? Is there any tenderness? Okay. Okay, everything seems to be okay. I'm also palpating for lungs, for bones, palpating for temperature, for moisture. Yeah. Okay. For abnormal vibration. Okay. I can't feel anything. Everything seems to be okay. Yeah. I'm gonna also be checking for the chest expansion symmetry. So I'm gonna be placing my hand at the 10th rib. So can you give me a deep breath? Breathe in, out. Breathe in, out. Breathe in, out. Okay, everything seems to be okay. Yeah, I'm gonna be checking your tactile fremitus. This is like a vibration caused by speech. So once I'm doing that, you're gonna be pronouncing 99, 99. So I'm gonna be using this on part of the finger. So can you say 99, 99, 99, 99, 99, 99? Okay. So the tactile fremitus, everything seems to be equal. There's no inequality. Okay. Yeah, I'm gonna be percussing also, percussing around the lung tissues. Yeah, to check the sounds, the vibrations around the lung tissues. Yeah, resonant sound is always found around the lung tissues. Yeah, resonant sounds. 。 Okay, everything seems to be okay. Yeah, and most times they are flat over the scapula. So next thing, I'm gonna be auscultating with my stethoscope. Yeah, in my auscultation I'm gonna be auscultating. I have some landmarks here. This is the first intercostal space, second, third, fourth, fifth, sixth, seven, eight, and nine. Yeah, I'm checking for the breath sounds, okay, on the posterior chest. Yeah, at the posterior chest we don't have the brachial sounds, okay, just like the anterior chest. We just have the brachiovesicular and the vesicular sounds. The brachiovesicular are found at the center of the posterior chest towards the T4, okay. Yeah, and the vesicular sounds, they are found at the vertebral body and to the lung tissues, okay, just below the shoulder blade. The shoulder blade seems to be has a kind of sound. It's not the vesicular sounds are not heard there, but just below them and at the vertebral border. So I'm going to be auscultating. So while auscultating, checking for the normal breath sounds, I'm also checking for adventitious sounds, which happens to be the added sounds like crackles, wheezing, stridor, and other ones. So can you breathe in for me? Breathe in. Breathe in. Breathe in. Out. Breathe in. Breathe in. Breathe in. Out. Breathe in. Out. Breathe in. Out. Breathe in. Out. Breathe in. 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 Out. Breathe in. Out. Breathe in. Out. Also, I'm gonna be checking the lateral area, towards the axilla. I'm trying to confirm some sounds I'm querying at the posterior region. Breathe in, breathe in, out. Okay, right now, Mrs. Susie, yeah, I'm done with the respiratory assessment and everything seems to be okay. You're doing good, okay? Yeah, okay. Right now, I'm gonna put you back in a comfortable position, which happens to be the semi-phallus position. So let me put you back. So right now, I'll cover Mrs. Susie. I'll cover her. I'll draw her bed rails. You see your bed rails, you can hold them if you have any issue. Then this is your call bell. You can call me when you have any problem, or you can call my attention using that. Yeah, at this point, is there any other thing I can do for you? Are you okay? Okay. Yeah, thank you so much, Miss Susie. Thank you for giving me your time. Have a good day. Bye.